for lunch, which means we got a long way to go. And that's fine. My goal is, you know, I used to like just speed through my slides. It's like, hey, if you can keep up, that's great. But if not, we're going to go anyway. So I've obviously slowed down the pace. But I think that's to everybody's advantage. So again, there's a basic protocol. I've published this just last year in a review article. I've published it a couple times, but this is like the newest version of it. You can get that from my website. And it helps people get off of this pro-inflammatory track that most people are on. If you look at the dietary patterns of most Americans and people in so-called industrialized nations and people who we force industrialization on, they end up consuming a diet that's pretty high in high sugar foods, fructose, glucose, sucrose. And so what's the effect of that? It causes immune suppression and oxidative stress for about 4 hours, so it's no surprise that we see a lot of chronic infections and chronic inflammatory disorders. Typically the foods are high in fat, especially as we said before, trans fats and or saturated fats. Some things you have to know about saturated fat. So earlier I talked about hypothalamic inflammation. One of the ways to create or induce hypothalamic inflammation is by feeding animals and theoretically therefore humans saturated fats. Saturated fats activate a receptor called TLR4, which stands for toll-like receptor 4. So TLR4 is one of the major inflammatory, let's say, pathways or gateways, and it's activated principally by two different agonists. So if we want to talk about what is the activator of TLR4, the two answers on my exam are going to be microbes and saturated fats. So another way of saying that, TLR4 presumably was meant to receive microbial information, so to speak, and help modulate the immune system's response to that. But if that's true, and it is true, then another way of saying this that I'm trying to say is that the body responds to a high saturated fat diet as if it's fighting an infection. So, and one of the pathways that gets activated is TLR4. That causes hypothalamic inflammation. In a state of hypothalamic inflammation, the body is more likely to deposit fat. So part of the reason we want patients on a low saturated fat diet and or we want to supplement them with omega-3 fatty acids and omega-9s in the form of oleic acid is we're trying to reduce hypothalamic inflammation that's been induced either by microbes or by saturated fat, right? So if you put patients on a low saturated fat diet and or if you address their chronic microbial infections, then that can help them lose weight. High fat foods, as I just mentioned, fatty acid imbalances. Most people don't get enough ALA, EPA, DHA, and GLA. Therefore, no surprise that we see this abundance of inflammatory conditions in our practices. And inflammatory conditions can be anything that you think of. Parkinson's, Alzheimer's, cardiovascular disease, diabetes, in addition to allergy and autoimmune conditions. And as you will come to appreciate as we continue this conversation, you know, in the past, I think we thought of fatty acids as having an anti-inflammatory effect or blocking cyclooxygenase or lipoxygenase. And then, of course, we certainly thought about EPA and DHA as having roles in the brain because DHA is concentrated preferentially in retina and the brain, for example. But I think we also have to appreciate, for example, that DHA from fish oil plays an active role in mitochondrial function too. So there's an enzyme it's involved in the Krebs cycle as well as in the electron transport chain called succinate dehydrogenase. And succinate dehydrogenase is actually adhered to the inner mitochondrial membrane structurally. And the way that it adheres to the inner mitochondrial membrane, I believe, is through the fatty acid, or yeah, it's not really fatty acid, but it's cardiolipin. And one of the main components of cardiolipin is DHA. So another way I can say all that, having just reviewed the structure, is DHA is necessary for proper mitochondrial function. DHA is the anchor for the enzyme succinate dehydrogenase, and two components of that anchor, well, it's a component, DHA is a component of cardiolipin, which is the real anchor. So in other words, if patients don't have enough of these fatty acids, their mitochondria are not going to work optimally. Because if there's no DHA, there's no cardiolipin. If there's no cardiolipin, then the enzyme succinate dehydrogenase, which actually is present both in the Krebs cycle and in the electron transport chain, the enzyme can't function optimally. So in order to optimize mitochondrial function, we have to optimize their fatty acid intake. See, that's just more detail than you get in the notes. Sure, go ahead.
For saturated fatty acids, are you delineating medium and short chain versus long chain?
Good question, and mostly good question. So mostly when I talk about saturated fats in this global sense, in the pro-inflammatory state, I'm talking about long chain saturated fatty acids. Some of the shorter chain ones, like from coconut oil and things like that, not so bad. Vitamin and mineral deficiencies are rampant, especially magnesium and vitamin D. I'm sure for those of you who are actually doing vitamin D testing, I'm sure you find most of your patients deficient, right? If you look at studies done in Florida and Arizona, which are obviously the southernmost states where they get plenty of sunshine, they still find people vitamin D deficient all the time. When I was in my 4th year of medical school, we tested vitamin D levels in 157 patients coming to our rheumatology clinic, and out of 157 patients, 156 of them were deficient. So we only found one who had what I would consider to be optimal vitamin D status. So in other words, your patients are very vitamin D deficient unless you're supplementing them and testing them and monitoring them appropriately. Allergens, a lot of people develop food allergies. So what do we do about food allergies? First of all, we have to be aware of them. Second of all, we can do elimination challenge for patients who are allergic to whatever it is they're allergic to. But there are 2 other steps we can take, and that we'll talk about as today goes on. Anytime you're dealing with a patient who's got multiple allergies to foods, you obviously, I hope, are starting to think in terms of leaky gut. And therefore, if you're thinking leaky gut, then you have to think of what causes leaky gut, right? So it's not enough. I mean, it's great. It's a great advance to at least think about leaky gut, because obviously the medical profession mostly doesn't. But you have to, go beyond that. And then if you have a patient who you think has leaky gut, you have to know what causes leaky gut, right? So how many, at least in my books, there are 6 causes of leaky gut, 4 of which you can exclude by history and physical exam alone. So then that only leaves 2 that you have to guess about. And the 2 that you have to guess about are food allergies, because leaky gut causes food allergies, but food allergies also cause leaky gut. So it's a vicious cycle there. And the other thing is gastrointestinal parasites. And when I say parasites, I really mean dysbiosis. And when I say dysbiosis, I mean anything that's growing in their guts that shouldn't be there, whether it's bacteria, amoebas, other protozoas, or fungi. Now, we'll go through some cases. Insufficient phytonutrients. If people aren't eating a plant and vegetable-based diet and they're not taking like a phytonutrient concentrate, then they are deficient in phytonutrients. And therefore, what would be the expected outcome of that? They're going to have more inflammation, pain, and oxidative stress. And their mitochondria aren't going to work as well. Insufficiency of fiber. I mean, the most obvious consequence of that is increased risk for colon cancer and increased risk for constipation. If people are constipated, then they're not detoxifying on a regular basis. They're going to develop, or at least they're predisposed to develop bacterial overgrowth. They're predisposed to develop, absorb more toxins from their gut. So we want our patients having a good bowel movement at least every day. Twice a day would be nice. And you can promote that through plant-based diet. Make sure they're on vitamin C, 3 to 6 grams per day. That'll help hydrate their stools and help them have bowel movements. Make sure their thyroid status is sufficient, and make sure they don't have bacterial overgrowth of the small bowel, which actually promotes constipation as well. Foods that promote bacterial overgrowth: sucrose, wheat, potatoes, and lactose and dairy. So just a few minutes ago when we were in the break, I was talking with someone about gluten allergy and celiac disease and all that kind of stuff. I personally, for the most part, don't care if my patients have wheat allergy or celiac disease, because I don't want them eating wheat anyway. So if a patient comes into my office and says, look, I don't have celiac disease, I don't have to follow your dietary recommendations, then we have to sit down and talk about that. Because, number one, I'm right. And they need to not eat wheat, right? So regardless of whether a patient has or doesn't have celiac disease or an IgA or IgG or IgG4 or IgE antibody to gluten, it doesn't matter. Like I said before, part of what we have to think about when we're discussing food intake is we have to ask, what is the effect of that food on overall physiology? Not simply looking at vitamin and nutrient content, not simply looking at carbohydrates, fats, and minerals and vitamins, but looking at what is the effect of this food in the human body. And when we look at the effect of wheat, regardless of whether a patient has celiac disease or wheat allergy, the fact is wheat promotes bacterial overgrowth of the small bowel, and that's a major problem. Especially if you're dealing with patients who have rheumatoid arthritis. So what percentage of patients with rheumatoid arthritis have bacterial overgrowth? I think it's somewhere between 40 and 80%. What percentage of patients with irritable bowel syndrome have bacterial overgrowth? At least 80%. What percentage of patients with fibromyalgia have bacterial overgrowth? According to some studies, it's 100%. Right? So if you're not treating bacterial overgrowth and if you're not addressing that, you might be getting great results, but you could probably get better results if you were to address that component of their problem. And one of the ways to address it is low carbohydrate diet, specifically avoiding grains and potatoes, and then using some type of orally administered antimicrobial like berberine or oregano oil. Those are two of my favorites. Dysbiosis, we'll talk about this more this afternoon. A lot of people, of course, don't get enough exercise. You know, the recommendations these days, even from the government and the CDC, Centers for Disease Control, is an hour of exercise per day. 5 days a week of aerobic exercise, and then 2 days a week of resistance training. When people exercise, they release certain cytokines from muscle called myokines, which have an anti-inflammatory effect. And obviously, they're building muscle, and they're reducing insulin resistance. Xenobiotic accumulation, of course, is pandemic. Everybody in here and everybody in the country and all of your patients have some level of toxicity, whether it's heavy metals, chemicals, or both. And that's especially true for patients who are overweight and diabetic and who have Parkinson's. I mean, Parkinson's is the classic example of chronic chemical toxicity. And of course there's a genetic component. And of course we don't have all the answers. But if you look in the brains of people who have Parkinson's disease, they have high levels of a pesticide called Mirex, which happens to be a mitochondrial poison. I don't think it's a mistake that it's there. Emotional stress and toxic relationships, of course, those have to be addressed as well. So here's a diagram from my book, which is, I actually learned this in philosophy class in chiropractic college. So one of my teachers at Texas Chiropractic College before I transferred to Western States was Dr. Ward. And I was so glad I actually showed up for class this day because he gave us this analogy, which for him was kind of like a teeter-totter. He said, you know, you eat a candy bar and your health goes down, you get adjusted and your health goes up. And ever since then, I started to look at health in terms of balance. And so here's my visualization on that. And what we try to do in functional medicine and integrative chiropractic, et cetera, is we try to get people off of the Western lifestyle and we try to get them on to what we can call a wellness lifestyle. And if you look at the wellness lifestyle, it's basically what we're going to talk about today. Healthy diet, nutritional supplements, and then lifestyle and emotional health. Whereas if you look at the items in the disease-promoting category, that's the way most Americans live. So is it any surprise then that their health is always declining and that we have to do this bubblegum and baling wire approach to healthcare just to kind of keep people out of the drink? So the components of diet that we're going to talk about right now: food-induced inflammation, oxidative stress, immune suppression, phytonutrient deficiency, sugar and insulin excess, GI dysbiosis, including bacterial overgrowth, deficiencies, and allergens. We already looked at this slide, so I won't go through it again. It just reviews the basic 5-part protocol. This was a great article written by my friend David Seaman, who I'm sure you all know, and he wrote this in JMPT. And the journal was barely willing to publish this article because it was radical and it suggested that people actually need to modify their diet in order to treat inflammatory conditions, right? What a concept. So this was published almost exactly 10 years ago. I thought David was obviously very progressive in his thought. And now, 10 years ago, this was a radical idea. He even published it under the guise of a question. But now we take this for granted, right? So a lot's happened in 10 years. And now we understand the mechanisms down to the molecular level. So unhealthy diet promotes inflammation. Grains, especially wheat. If you could get your patients off of any food, it would be wheat, right? So, and I've got a slide on it, so I won't go through it right now. But if you just scan that paragraph, you'll see that I talk about the Maillard reaction. And then we can consider any grain to be a refined carbohydrate. And when we talk about simple carbohydrates, we have to appreciate that they actually promote oxidative stress, antioxidant depletion, and immune suppression. And all of those things occur through affecting mitochondrial function. Lack of fruits and vegetables, nuts, seeds, and berries equals lack of fiber and other nutrients. It also means that pretty much by definition they have unhealthy gastrointestinal flora, which we also have to modify. A lot of patients, in my opinion, actually don't get enough protein, so I always want to make sure they're getting enough protein. So what would that be? At least 0.5 gram per pound of body weight, and if they're athletic and training, then probably 1 gram per pound of body weight. And I am saying 1 gram per pound. So like for me, I weigh about 215 or so, I'm trying to hit somewhere around 200 grams of protein per day, so that means 4 meals of 50 or 5 meals of 40, something like that. It sounds like a lot, but if you look at the research, in particular this article that was written by an author whose last name is Lemon, that's what he recommends, and based on that article and a few others, they all came up with the same number, which was for competitive level athletes, 1 gram per pound of body weight. So anyway, that's what I recommend. Doesn't mean they have to get there. They could be 0.8 grams per pound and that would still be okay. But I like for people to get enough protein. Most Americans consume too many omega-3 fatty acids, too many omega-6 fatty acids. What would that be? Like vegetable oil, linoleic acid is the classic omega-6, which actually promotes oxidative stress and inflammation and increases the risk for breast cancer in women, even though it lowers cholesterol. And arachidonic acid. So where do people get arachidonic acid? Mostly from animals, if those animals were fed grains. But if we're using like grass-fed beef, it's, the fatty acid profile of grass-fed beef is just as good as salmon. So certainly people can use grass-fed beef, but grain-fed beef means it's going to be rich in omega-6. Eventually that's going to mean it's rich in arachidonic acid, and arachidonic acid is clearly pro-inflammatory, right? It screws up calcium-magnesium balance within the cell. That promotes inflammation because it promotes high levels of calcium within the cell. And calcium, of course, is not simply a nutrient, it's also a second messenger. And so when levels of calcium within the cell are elevated, it promotes a pro-inflammatory state. So we can modify that through a couple of mechanisms, one of which is reducing arachidonic acid intake, another of which is using omega-3 fatty acids, making sure our patients get enough vitamin D, and making sure they're slightly alkaline, which for me is a urine pH of 7.5. So, moving on. Healthy diets have anti-inflammatory effects. Fruits, vegetables, nuts, seeds, berries, lean sources of protein, it's high in phytonutrients, promotes bowel movements, which people need to have on a regular basis. Low carbohydrate intake is great for losing weight and improving mitochondrial function. So, for example, one of the biggest lies that we're all taught in school is that ATP production is dependent on carbohydrate intake, right? That's what we're all taught. Well, if that's true, then feeding people high fructose corn syrup would be great because we're giving them a sugar, it's going to go into those mitochondria, it's going to make ATP, we're going to power up those mitochondria with fructose, right? Does that happen? No, because fructose actually costs ATP in one of its initial steps. So fructose is unique among carbohydrates in that it actually causes mitochondrial dysfunction. That's why we see so many disease associations with increased intake of high fructose corn syrup. So we want our patients generally to be on a low carbohydrate intake. The most sugary thing I consume, other than a little bit of dark chocolate, is carrot juice. And carrot juice, believe it or not, among juices is actually lower in carbohydrates. Carrot juice is 70 calories per serving versus like apple juice, which is 120 calories per serving. So anyway, low carbohydrate diet is the way to go. If you look at any condition we're going to talk about today, diabetes, hypertension, Parkinson's, well, let me say diabetes, hypertension, Alzheimer's, any allergic condition, part of what we're trying to achieve is a reduction in inflammation and an improvement in mitochondrial function. And we can achieve both of those just by putting patients on a low carbohydrate diet. The other thing we achieve with a low carb diet is we reduce insulin levels, of course, right? Because insulin levels are going to be high in response to dietary carbohydrate. So if we reduce dietary carbohydrate intake, we're by definition going to reduce serum levels of insulin, right? Well, that's a good thing because insulin promotes inflammation and it promotes sodium retention by the kidney. So when we look at this epidemic of hypertension, we find that it parallels the incidence of hyperinsulinemia. So if we can address the hyperinsulinemia, usually we can get people's blood pressure down, right? So how do we address hyperinsulinemia? Metformin, right? Or a low carbohydrate diet, which is more effective. This is the most nutrient-dense diet available, and it gets even more nutrient-dense when we add a multivitamin and multimineral. So nutrient density is a ratio of nutrients per calorie, which therefore becomes a ratio between vitamins and minerals, phytonutrients, over carbohydrates and fat. So if we have a low-carb, low-fat diet that's plant-based, it's going to be as nutrient-dense as we can possibly get it. Promotes alkalinization. As I mentioned just a second ago, we want a urine pH of 7.5. Anytime you do a urinalysis, you should be looking at that urine pH. A lot of times you're going to see it come back at 5.5 or 6. That's acidic, right? Because anything below 7 is acidic, anything above that is base or alkaline. For the most part, we want our patients at 7.5. So I'll tell you something right now that's not in your notes, and you might want to write this down. So what are the benefits of making patients more alkaline? And all of this has already been published in human trials, so this is not theoretical. And this is not my clinical discovery that I've only seen in my patients, and I don't have any data on it. This is all published in peer review. So what happens when we take patients who are slightly acidic, we call that diet-induced metabolic acidosis. When we take patients who have diet-induced chronic metabolic acidosis and we make them slightly alkaline by using baking soda, sodium bicarbonate, or potassium citrate, which is now available as a supplement under my direction, thankfully. Because of course the FDA limited the amount of potassium that people could take, right, to 99 milligrams or less per dose. So we had to kind of work our way around that into something that's actually more realistic. Why would the FDA limit potassium intake when there's no toxicity associated with potassium and it helps to get people off of their hypertensive drugs and things like that? Because it probably gets them off their hypertensive drugs. So what are the benefits to becoming slightly alkaline? So if you did nothing else to your patient other than change their pH, what would happen? Their cortisol levels would get lower. So cortisol levels go down when patients become slightly alkaline. Well, what's the benefit of that? Well, we know that higher levels of cortisol are associated with hippocampal atrophy, right? So part of the memory loss associated with chronic diseases is due to hippocampal atrophy, and that's induced by cortisol. So we're actually improving brain health just by changing their pH. And obviously cortisol has a role in insulin resistance and osteoporosis. So not surprisingly, we actually improve insulin resistance and brain health, or brain health and bone health, when we change people's pH. So cortisol levels go down and endorphin levels go up simply by making people more alkaline. Well, what happens when people have elevated endorphin levels? They feel better and they have less pain. So here's, you ready for this? This is good. So you've all heard of, and some of you have probably experienced, this thing called a runner's high. And it's thought to be caused by endorphins. What happens when people run is they hyperventilate. What happens when people hyperventilate is they induce respiratory alkalosis, which makes them more alkaline, which then induces the elaboration of these endogenous endorphins. So the mechanism of a runner's high is alkalinization equals endorphin excretion equals I feel great, right? So cortisol goes down, endorphins go up, the body retains more calcium and magnesium, and the excretion of xenobiotics and toxins is enhanced. So for those of you who are kinesthetic, and since a lot of you are DCs, I assume this is most of you, you can do this thing with your hands, which you've been seeing me do. Endorphins go up, cortisol goes down, nutrients stay in, and toxins go out, right? Just by changing pH. So I used to think pH was like some leftover remnant from the 60s and 70s. You know, it's like these people are just high, and I don't know what they're thinking of. And then in 2004, an article was published. The author's last name is Proudfoot, and if you Google Proudfoot and alkalinization, you will certainly come up with this article. The title of the article is Position Paper on Urinary Alkalinization. Again, it was published in 2004 in a journal called Toxicology and Clinical Toxicology. This is a position paper written by emergency medicine physicians, and it has been vetted by every emergency medicine organization in the US and in Europe. The conclusion of this article is that anytime a patient comes in toxic, poisoned through suicide attempt or industrial exposure, what they recommend in this article, more often than not, as a basic protocol, is what they call urinary alkalinization, which is any strategy to get the urine pH to 7.5 to increase toxin exposure, therefore reduce the toxic effects of whatever the patient was exposed to, again, whether it was suicide attempt or toxic industrial exposure. So that's where I first came to this idea. It's like, wow, if this has been endorsed by all these emergency medicine physicians internationally, then there must be something to it. And then I just started looking at more and more work. Anthony Sebastian in Europe is one of the leading researchers on this topic. So if you look up alkalinization and pH and urine and Sebastian, you'll find some of his work. And the work is very solid. There have been other studies, for example, by a researcher in Germany. His last name is Gorman. He's published 2 clinical trials on alkalinization in patients with rheumatoid arthritis or back pain. And what he showed in patients who have chronic back pain, if you make them slightly alkaline, it reduces their pain and increases their intracellular magnesium content. So we can actually help patients retain magnesium both on a body level and on a cellular level by making them more alkaline. So I won't spend more time on that since we're about to go to lunch. Sufficient protein intake and omega-3 fatty acids, physiologic amounts of vitamin D. This slide, which you have in your notes, just goes through basic dietary patterns. The one that we're going to focus on, rather than looking at all the bad ones, let's just focus on the paleo diet. Unhealthy food, as I mentioned before, causes inflammation, and here's a clinical trial showing that. This was a clinical trial published in 2004, American Journal of Clinical Nutrition, showing that when people consume a fast food breakfast like hash browns, sausage, and eggs, that it activates NF-kappa B by 150%, and that effect lasts for 2 hours. So what you can explain to your patients who have inflammatory disorders is that when they eat unhealthy foods, they're actually causing the inflammation that's causing them pain. And if you can get them to eat a healthier diet, which is a low glycemic index, low glycemic load, etc., then they can reduce their own inflammation. 2 studies have shown that when